Okay, next case. You are called to see a 74-year-old patient who was initially admitted for pneumonia and is now showing signs of delirium and psychosis. The patient has no relevant psychiatric history recorded in her chart, but she tells you that she can see her deceased husband standing in front of her. On examination, the patient appears to have fluctuating consciousness, impaired memory, and obvious agitation. You decide to order a series of studies in order to rule out any organic cause for her delirium, but in the meantime you administer medication that will block the postsynaptic dopamine receptors in the limbic system and hopefully relieve some of her symptoms. Typical antipsychotic agents. So these typical antipsychotic agents include, for example, haloperidol, Haldol, flufenazine, and which are both high potency drugs, and chlorpromazine, theoridazine, both low potency drugs. So the mechanism of action blocks postsynaptic dopamine D2 receptors in the limbic system of the brain, thereby decreasing the response of the postsynaptic neuron to dopamine excitation. These drugs also produce some inhibition in the H1 histamine receptor, cholinergic receptors, and alpha adrenergic receptors, which leads to a host of undesirable side effects. So clinical use is for positive symptoms of schizophrenia, not the negative symptoms. For example, delusions, hallucinations, Tourette syndrome, delirium, and agitation. Side effects: sedation, anticholinergic side effects, dry mouth, urinary retention, blurry vision, amenorrhea, tardive dyskinesia. Some patients may develop neuroleptic malignant syndrome, which is characterized by muscle rigidity, change in mental status, elevated temperature, autonomic instability. This syndrome can be treated with dantrolene, which is a muscle reactant, and dopamine agonist. So the main points here for these typical antidepressants: they block the postsynaptic dopamine D2 receptors for uses of positive symptoms of schizophrenia. You might get sedation, might be sedated, similar drugs, haloperidol, flufenazine. Okay, let's learn this.